there's a new COVID variant in the US. It's called Mu. The World Health Organization recently labeled it a variant of interest because of its potential to evade the immune system, making some people nervous. Verify viewer Craig emailed us asking, are COVID variants like Mu more serious than the original? Well, Craig, let's verify. Our sources are GISAID, which tracks variants globally, the Centers for Disease Control and Prevention, the World Health Organization, Dr. Anthony Fauci, and 2 infectious disease doctors.
The new variants are not necessarily more severe or more transmissible.
There are 7 variants between Delta and Mu. According to Dr. Campbell, there's good reason you probably haven't heard of them.
All those other ones between Delta and Mu exist, but they're not so much more transmissible that they took over.
According to data from the CDC and NextStrain, Delta accounts for 99% of new COVID cases in the US and roughly 88% of cases globally, making it the dominant strain. Now let's talk about Mu specifically. The variant was first identified in Colombia back in January, but now it's in dozens of countries, including the US, where more than 2,400 cases of Mu have been confirmed across all 50 states. While Mu is the dominant variant in Colombia, it accounts for less than 1% of all COVID-19 infections in the U.S. as of September 15th, according to GISAID. Concerns about the Mu variant grew when the WHO recently labeled it a variant of interest. These are variants that haven't spread far but are contributing to an increased proportion of cases or outbreak clusters, according to the CDC. During a news conference last week, Dr. Fauci confirmed that the Mu variant has the potential to be more resistant to antibodies than other variants, but says it's too soon to tell.
This variant has a constellation of mutations that suggest that it would evade certain antibodies, not only monoclonal antibodies, but vaccine and convalescent serum-induced antibodies. But there isn't a lot of clinical data to suggest that. It is mostly laboratory in vitro data.
As a virus spreads, it makes copies of itself. According to Dr. Bollinger, that's when mutations happen.
Sometimes it changes for good, sometimes it changes for bad, but it changes every time it replicates.
So we can verify, COVID variants like Mu are not always more serious than the original. With your Verify, I'm Ariane Till.
And if there's anything you'd like us to verify, just send a message to our email, verify@12newsnow.com, or message us on social media.